So it's becoming a yearly problem. The health department missing its own end of October deadline to place junior doctors in their mandatory community service posts for the next year. Without this community work, they cannot qualify, and despite a desperate need in our hospitals for more doctors and the current pandemic, this issue remains. I'm joined now by Dr. Tshepile Tlali, acting chairperson of the Junior Doctors Association of South Africa. Doc, I can't believe we're having this conversation again. How many years have we had this problem for?
Back again, Sally. It's been many years now. It's been slowly brewing for at least the past 5-6 years, as a result of the increase in the number of medical students who have been taken into the medical schools, as well as the the Nelson Mandela Fidel Castro program.
Sure. So let's just get an understanding of the scope of the problem. So you were explaining to me before we went to air that when you finish studying, you have 3 more years to complete, 2 years of internship and then your final year of community service. My understanding is that the internship placements are sorted, but it's that final year of community service where the problem remains. Am I right? All right. So how many people are affected by that final community service year?
There are 2,252 community service applicants from this year who have applied to start by the 1st of January 2022. Currently, none of them have been placed. The Department of Health tells us they currently have posts for funding for 1,558 posts.
So that's going to leave about 700. But so are you saying that
764, yeah.
None of them have a clue where they're going in January? Sorry, I'm battling to hear you.
Today's the 7th of... Sorry, none of them know where they're going in January, and today's the 7th of December, which leaves them with, what, 24 days?
Yeah, I mean, it's crazy. I spoke to the Deputy Health Minister last week. He told us that this matter was a work in progress. Those were his words. He said they needed about a week or two to sort it out. So have you heard anything from the Department of Health this week? Have you had any communication on when they're going to help you?
The last time we communicated with the Department of Health was last week, Thursday, where we had a joint meeting with the South African Medical Association's Board of Directors and us, the Junior Doctors Association of South Africa. They were just kind of telling us what the problem is and where the issues are in terms of funding and treasury. They unfortunately could not give us a deadline or any kind of light into when they're going to place the community service doctors. Since then, we haven't really received any communication from them, and we don't know when they're going to be placed. However, the South African Medical Association has released a statement on Sunday requesting that the Department of Health place all the community service doctors by the 16th of December, which is ample time, failing to which then we will be considering legal action.
All right, and it's sad that that threat had to be made the last time, if I'm not mistaken. I was reading a really interesting article written yesterday for the Times Live online newspaper, and this is the quote from a junior doctor. "If they can't guarantee us posts, we have no other option but to go overseas, because we are legally not allowed to practice in South Africa in the public and private sectors." Are we in real danger of losing a significant chunk of our young doctors to immigration because of this problem, or is that not so much the concern?
Unfortunately, we are already losing a lot of doctors due to immigration. As I'm sure you can assume, the issue does not just stop with community service. After completing community service, we have thousands of, I would say, 1,000 to 2,000 of doctors who are waiting, who have applied for jobs for next year, who still haven't heard anything. And there's a big lack of job security currently in the medical field in terms of the public sector, and a lot of young doctors still want to practice in the public sector so that they can further their qualifications before delving into the private sector. And without an option to enter the public sector, a lot of them are considering moving to countries where they want South African doctors, such as Ireland, Canada, and Australia. So this is not a new problem, and we are really, really in danger of losing a lot of doctors to immigration, which is only going to make the problem worse.
Absolutely. Have you got any ballpark sort of percentage on what proportion of our young doctors are considering leaving?
I cannot confidently say what the percentage is because we haven't really done a survey on it.
And it's such a shame because, of course, we're moving into our fourth wave. We actually are officially in our fourth wave now. And the jury's still out on what Omicron exactly is going to do to hospitalizations. But we certainly are going to see, and we have already seen, an uptick in hospitalizations. We don't have enough doctors in our hospitals as it is. It must be intensely frustrating to know that you have the skills, but you're not being asked to help.
I can't even describe the feeling that I have as a doctor, knowing that there's a big problem that's affecting the whole world, and our country cannot even provide the services to assist with this problem. All it leaves is doctors and other healthcare workers who are overwhelmed, suffering from burnout and other mental and psychiatric conditions because of this. It just makes you feel despondent to even serve anymore, because the people who are supposed to be protecting you and giving you the motivation to continue serving the country that you live in can't even give you that assurance that you'll have extra hands to help you.
Yeah. It's a crying shame. Thank you so much for that update. And we're certainly going to keep on this story. Dr. Tshepile Tlali, Acting Chairperson of the Junior Doctors Association of South Africa.